Hi, today I will be going over how to instill eye drops. So first I will wash my hands, perform hand hygiene, and then I will don gloves. And then after I don gloves, I have all my supplies already ready. I have my eye drops, I have a tissue, and my gloves are already on. So this is my patient. I will first make sure that I have the right patient. So I would ask for two identifiers. So name and date of birth, please.
Julie Lee and November 9th, 1997.
Okay, after I make sure I have the right patient, I will go over my 7 rights, which is making sure I have the right patient, right drug, right dose, right route, right time, right documentation, and the right to refuse. So after I go through all of that with my patient, I will get a clean washcloth. It could be a little bit warm, and I will assess my patient's eye for any redness or drainage, and if so, I will clean from inner eye to outer eye, and I will also clean the lower sac just because that's where I will be instilling my eye drops. So I will uncap my eye drops with my non-dominant hand. I will slightly tug on the lower sac, and I will instill eye drops from up here, making sure that I don't instill into the eyeball, that I do instill into the lower sac. And then after I instill, I have my patient close her eyes, and then I will put pressure on the inner canthus, and this will prevent the eye drop medication from going into the systemic circulation. That's where we don't want it. And then at this point, I can have my patient roll her eyes around just to absorb the medication even further. And about a minute or so later, I think I'm okay to remove, and the patient could open her eyes now. And then secondly, I will go over how to instill eardrops. So with my patient, she's gonna need eardrops in her left ear. So I will have patient exposed left ear, and then I will clean my hands, don gloves, and I have my eardrops and all my supplies ready. So if my patient is 3 years old or older, I will pull up and back, and if she or he is younger than 3 years, then I will pull down and back. And then I will squeeze the number of drops into my patient's ear, making sure first that it is at room temperature. And then after the appropriate amount is in, I will pump the cartilage, and this will ensure that the patient's medication is thoroughly in her ear. And I would have my patient stay in this position for about 2 to 5 minutes. And if I do see any leakage or drainage, I can roll up a tissue and just gently clean her ear, make her feel more comfortable that everything's not wet or anything like that. And then after 5 minutes, she can go back to her normal position. And then thirdly, nasal spray. So I'm just going to be educating my patient how to use a nasal spray. First, I'll make sure I have the right medication, right dose, right route, everything like that. And then I will lean my head over, pulling down a little bit. I will open up my nasal spray. I will squeeze the number of drops into my nose, spray into my nose, but I won't aim it directly up. I want to aim it a little bit to the side. So if I'm doing my right, then angle it a little bit towards your right ear, and if I'm doing my left, then I would angle it towards my left ear. And I will spray the appropriate amount of sprays, and I will slowly snort and make sure that everything goes up. And if I need, I could use a tissue just to blot dry anything. And then inhaler. For inhaler, you want to make sure that you shake your inhaler before using. If it's fresh out of the box, you want to prime, and priming is just uncapping, making sure you shake to mix the mixture, and then you would spray 2 times away from yourself. So after you make sure that everything is primed, you would want to sit up straight. You want to remove cap, shake, and then breathe out gently, and then inhale as you pump. And then after you pump, you want to make sure you hold your breath for 10 seconds or longer, however, until you're uncomfortable. And then you just follow on the procedure. If you need 2 pump, then you would do the same thing twice. If you need 1 pump, then just do it that 1 time. And then for tube medications, you would wash your hands.
Wait, this one first.
I'm doing the IM injections. So I will have all my supplies ready. I would wash my hands. I would don gloves. I want to expose my patient's deltoid, so I would have everything rolled up. And if you aren't able to roll up your patient's sleeve, you want to remove the shirt. And then to make sure I have the right position, I want to use 2 to 3 finger width away from her shoulder. So this is the injection site. I want to make sure I clean my injection site with an alcohol wipe, and I would clean in circular motions in upwards and outwards. And then I would discard that. And then I'd want to make sure a patient is relaxing her arm, and then I will perform Z-track method. And then for Z-track method, you want to take your non-dominant hands with the glove, and you want to just pull the patient's skin out like this, and this will ensure that the patient's more comfortable, and whatever medication is going in will stay in that muscle and nowhere else. So I would take my uncapped needle with the medication in it. I would come in at a 90-degree angle, and at that angle I want to be really stable, and then I will push the medication into the deltoid, and after everything is in, I want to at least stay for another 10 seconds just to make sure that no medication is going to come out when I remove. And then after 10 seconds, I want to remove at the same angle that I had inserted the needle, and then I will ensure safety, toss it into the sharps container, and if there's any blood, I can use a gauze, put pressure on it for a little bit, and then after the bleeding is over, or if you do need a Band-Aid, then you can at this point put a Band-Aid on, and then the patient is all good to go. And that was an IM injection. And then now for the G-tube medication, you want to perform hand hygiene, don gloves, check for placement, and you could do this in 3 ways. You could perform an X-ray, which is the most appropriate, and then you could use a measuring. You can measure the tube to see where exactly it is inside the patient's body, or you can check the gastric contents, which is what we usually do at hospitals. And to check this, you want to make sure that the contents is greenish, tan, or an off-white. That ensures that you're in the correct position. And then after that, you want to do all the 7 rights. Make sure you have the right patient, drug, dose, etc. And then now I would crush the medications, but I won't mix it. So whatever medication is going into the G tube, I will have all that ready. And then I will, so I would have my patient at a 30 to 45 degree angle to make sure that everything is going in correctly and she's not laying down, or he or she's not laying down. I would don gloves, and before medication, I would flush 30 milliliters, and then I would give my medication. And at this point, if you're using more than 1 medication, you would flush another 5 to 10 milliliters in between the medication you're giving. And once everything is over, you're done administering the medication, you will flush another 30 to 60 milliliters. And then after this, you want to make sure that the patient is upright for another hour, just to make sure that the medication, everything is going in correctly, and there's no that there's no problems there. And then after the hour, the patient should be good to continue going back to whatever position that the patient wants to lay. And that was it.